Hey guys, all right. So, as the title said, going live today. I'm gonna be inviting a guest here. I'll introduce really quick and then I'll watch out for her. But Christine is gonna be joining us a little bit to talk a little bit about women's health, and I'll tell you guys a little bit more in just a second. I want to see if she's there. Oh, she's right there. Perfect. We're gonna add her on. Bring them on camera. Bring her up on camera. Saying, oh yeah, okay. There you are. Hello. What's up? All right, let's see. If anyone's
Do I need to go?
Yeah,
should I flip?
That's what I was wondering. I don't know if oh, there we go. Yeah, there you go. You're good too.
Maybe that's better.
Yeah, perfect. Hey, that wasn't too bad.
Cool.
I haven't done this often, so I was like, I don't know what this is gonna be like. So, worked just fine.
Together, it's all good. Is my audio okay? I figured this might be helpful instead of not having some type of microphone.
Right. No, it sounds pretty good to me. Sounds good to me. Thanks for everyone for jumping on. But awesome. All right, well, we'll get started. I kind of started introducing, but I was like, we'll wait till you hop on. But as the title says, I have Christine here with me. We're going to be talking a little bit about women's health today, specifically if you have issues or if you know anyone who has issues with leaking while running. It's a pretty common thing that happens, but it's not normal, so she's going to talk about that. And then we're going to talk a little bit about exercises to do during and after pregnancy. I get asked that a lot. So I just want to bring her on live here because I think it could really benefit anyone really, but especially the runners that I work with here. So anyway, so Christine, thanks for joining us today. If you want to go ahead and just introduce yourself and who you are, where you live, and all of that.
And thank you all for joining today. My name is Kristen Pieton. I am a physical therapist in Santa Barbara, California. And I specialize in women's health as well as ortho and kind of sports-specific rehab. So I do kind of a blend of all of those things. And I became passionate about more of the women's health aspect probably about a year and a half into practicing. When I graduated from PT school, I thought that I was just a diehard sports and ortho PT and appreciated pelvic floor rehab, but I was like, that's not my jam. Pelvic floor is totally not related to sports and ortho. I was so wrong. But my patients fortunately kind of helped direct me down that path and realize that my perspective was incorrect. And I had a couple of really awesome runners and a few CrossFitters that I worked with a lot in that kind of first year and a half of me practicing as a clinician, and noticing that we got them so much better, but then there was still this kind of nagging piece that wasn't quite resolving itself. And at the time, I was really lost and unfamiliar and kind of like, well, God, I don't know what else am I missing, and started to kind of dig in a little bit deeper with them. And fortunately, they were brave enough to be like, yeah, I have leaking, or, you know, I have these other kind of symptoms. A couple of them even admitted to me like, hey, yeah, like, do you think my back pain or my hip pain, like I noticed that it's worse like during and sometimes right after sex and things like that, and being like, whoa, okay, what's going on here? And so ended up saying to myself, like, okay, I need to go like learn some more info. I'm going to go take a pelvic floor course and just sort of become more knowledgeable in this area, because pelvic floor rehab is not in the traditional PT curriculum.
Right.
So you learn it after PT school, which is a whole nother interesting situation. But that's for a whole nother podcast. So I decided to go to this course and be like, okay, I'm just going to go learn and kind of better understand what's sort of going on and know how to better refer out, basically. And after the 4-day course, I was really, my perspective totally shifted. And I was like, I have to treat this area. This is really important. This is also such an, quality of life important area to treat in terms of bowel and bladder function, as well as sexual function, all that stuff. And it absolutely feeds into our orthopedic cases and our low back cases and our hip cases, and getting back to higher dynamic activities like running and jumping and lifting. So it's all related, which is kind of how I came to be in this field. And then being a runner myself, running is a big passion of mine. I've run all the way since high school and stuff like that. So I know that this is a big pain point for a lot of my runners, and noticing how much our pelvic floor health, in addition to our hip stability and our core stability, is really vital in order for us to be able to make the gains and the progress that we want in our running careers, whether that's just a recreational runner or a professional runner. But either way, if we don't have an adequate stability system within that pelvic floor team, the body can't achieve its optimal performance. So really kind of digging deeper into, if we're having these issues, what's going on? Because there's a bunch of different reasons why.
Yeah, no, that's awesome. Thank you. Yeah, and I brought her on because honestly, I get a lot of questions from runners, and like she said, we don't get this really, I mean, outside we learn the muscles and all that stuff down there, but outside of that, we don't learn that much in our schooling, and it is something we have to pursue, you know, after schooling. And so I was asking her some questions. She's like, let's do a live. I was like, awesome. This will be helpful to my viewers as well, and I'll get to learn a little bit too. So, yeah. So tell me a little bit about, you know, we talked a little bit about it already, but leaking during running, and you know, how common is it really, and why is it not okay? You know I hear all the time runners are like, well, you know, I had a baby, or I know sometimes it happens besides that, but it's just going to happen. But can you share with our viewers like why it's actually not okay and you want to fix it?
Things. Basically, whenever there's any leaking with higher dynamic activity, and we're going to obviously be talking specifically more to running because of just the nature of your specialty and things like that. But basically, any higher dynamic activity, you know, running, jumping, let's say heavy overhead lifting, you know, like a CrossFit type high intensity workout. I'm going to kind of lump in this whole, when I say running, it also kind of spreads into those categories as well. And any symptom of that is the body saying, hey, I need help, and I'm having an issue with maintaining a healthy amount of intra-abdominal pressure. And intra-abdominal pressure is the amount of pressure that our abdominal cavity is maintaining in order to create a stable foundation for our torso over our pelvis for whatever activities we're doing. And that intra-abdominal pressure needs to change depending on what activities we're doing. But in a case like running, if we are not able to maintain a healthy amount of an intra-abdominal pressure system, then the body needs to release that pressure somewhere. So that pressure is then often released downward, because we have gravity forces going straight down, but also the fact of how our deep core system is structured. The easiest way for that pressure to exit is down through our pelvic floor, which puts pressure directly on those internal organ structures, and the most common victim is then usually the bladder. So the deep core system, just to kind of also clarify for people, involves 4 main important muscle groups. So we have our diaphragm, so that breathing muscle that sits right at the base kind of our rib cage. You have your pelvic floor all the way at the bottom. And then you have your transverse abdominis that wraps horizontally around our kind of, you know, core area, or traditionally what people identify as their core. And then we also have our deep back muscles called your multifidi. And the 4 of those together create a muscular corset of stability. And they're the 4 players that are in charge of maintaining that healthy amount of intra-abdominal pressure. Okay, so if there is a weak link in that system, or multiple weak links, then that doesn't allow those 4 players to work efficiently to create a healthy amount of intra-abdominal pressure on a consistent basis / adapt for whatever activities we're doing. And then on top of that, like I was saying, that pelvic floor, out of all 4 of those, if you think about, well, there's no hole or exit strategy for that pressure to be released up through the diaphragm, so it's not going to go that way. It's not going to go forward towards kind of our belly button because, again, we've got a lot of other fascial structures that are there to block it. Same with behind us with our spine and our multifidi. So really, the next best place to release that pressure is down. And especially in the construction of a female pelvic floor, we have a couple of other options in terms of an easier exit strategy, which leads us to be a little bit more predisposed to these leaking issues than our male counterparts.
Makes sense. That's super helpful. I learned a lot. I was taking some notes. I was like, all right.
Yeah.
That's super.
So speaking of, I think too, you asked kind of like prevalence and things like that.
Yeah.
And I also kind of want to myth bust a little bit here in terms of, I think a lot of the general public, if they're even aware of this issue or pelvic floor itself, think that it's often only an issue if someone has been pregnant or if they've had a baby. It is not. Anyone that has a pelvic floor can unfortunately develop a pelvic floor issue. Okay, so men can have pelvic floor issues. I do not specialize in this area, but there are clinicians that do. So just know that that is a thing too.
Yeah.
But women and pelvic floor issues can happen across the lifespan. So there are even pediatric cases where there are pelvic floor dysfunctions. So know that no one is immune to this issue. However, yes, there tends to be a higher prevalency of pelvic floor dysfunction that is correlated with pregnancy and delivery and postpartum periods, just because of the nature of that event on the body and all of the changes that physiologically have to happen to a woman's body in order to accommodate that. But it is not required in order for someone to develop a pelvic floor issue.
Yeah, I'm glad you said that. Yeah, just so, someone, if they're having that issue, they're not like, well, I haven't even been pregnant, and like, you feel like something's seriously wrong then. But no, it's totally common for that to happen too. And I'm glad you touched on that it can happen in men as well, because I know even for this live today, I was like, targeting ladies, but I was like, I don't want any guys to feel like, if they have issues too, it doesn't relate. But I just knew, you're a women's health specialist. So, but thank you for touching on that. What would you recommend? So if someone, has these issues, what would you recommend they do?
A couple of things. A lot of times, if it's just a leaking situation and if it's just occasionally here and there, I tend to kind of recommend people, basically, if you have leaking at all, it is totally in your best interest to seek out a pelvic floor physical therapist and get some help and get some information. And the sooner that someone can do that, and especially if the leaking is just kind of sporadic and just maybe happening here and there, it means that your body has some capacity, but it's needing some help, and probably in those higher stress situations, or maybe when we're getting to, let's say in this case, further into your run where you're getting more fatigued, the body just doesn't have the endurance to be maintaining the support that you are asking from the body to do. So in that case, the sooner you can get help, obviously, the better with it, and not really ignore it, because the pelvic floor issues can become bigger issues that isn't then just leaking, but we can have kind of back pain issues, hip pain issues, all these things, because the muscular systems of the low back and the hip all share fascial connections into the pelvic floor, as well as the kind of abdominal muscles too. So anytime that there is a weak link in the system, the other surrounding structures are going to want to try to compensate. And so they're able to do that a little bit in the short term, but eventually that capacity is also going to get reached. And so then we start to have bigger issues and more in terms of the rehab process. So earlier is always better. However, I understand sometimes too, people are like, oh, well, it just happens like a little bit and it's not super regular and consistent. So maybe, I'll just kind of just work through it. In those cases, I encourage people to be really thoughtful of the duration of those higher intensity workouts you're doing, and really try to honor how long your body can actually tolerate it without leaking, and stay within those ranges to try to strengthen, and then slowly challenge yourself to add on a little bit more time or mileage or whatever it is that you're working on, so that your body has time to adapt and work up to those more stressful environments in terms of duration and weight or distance, so that your body can accommodate those changes rather than just continuing to push past their limit.
I like that. That's helpful. So for the most part, they're having this issue, probably, seek out a women's health specialist in their area. And if anyone watching this has any questions, you can reach out to either of us with help, even if you're not in either of our areas, with finding someone. We can help you what you should look for finding someone. Do you ever give any advice if someone's not in person with you, or as far as, is there any advice you will just give without having to see someone, or should they really see a women's health specialist?
And it's in everyone's best interest to see someone and because each case is really individual. There are some things that will be, yes, the same across certain spectrums, but the other thing too, especially with this pelvic floor condition, and this is sort of another myth buster too, is that people sometimes automatically assume that they're having leaking issues because their pelvic floor isn't contracting well. But there are times when we can have a pelvic floor that is overactive and too tight that's causing leakage, as well as we can have muscles that aren't strong enough and are on lax that aren't providing stability for that pelvic floor. So if we give blanket statements in terms of, usually the other kind of blanket statement people get is like, oh, just do a bunch of Kegels, right? So yes, Kegels are helpful in terms of understanding and coordinating that contraction of our pelvic floor. But if someone has an upregulated pelvic floor and it's already tight and they're told to do Kegels, it's going to make their condition worse.
Okay.
So in that that's something that most people don't know.
Yeah.
They don't even, most people aren't aware that the pelvic floor can actually be too and acting in a way that is actually creating more of an issue in the system, and they need to learn how to relax their pelvic floor instead.
Yeah.
So that's why I always say it's really beneficial to seek out a pelvic floor therapist. You may get all the info you need in one session versus spending weeks or months or maybe years with this issue and not really knowing what's going on, when you could just meet with a PT for an hour or maybe 2 sessions.
Yeah.
And I find that I have a handful of my athletes or my patients that come in, and I can myth bust a bunch of things for them, evaluate them really quickly and go, actually, this is you. This is what you need to be doing. Do these couple of things, and they're on their way. And so I think too, sometimes people might be concerned to try to reach out to a pelvic floor PT or PT in general, thinking, oh, I'm going to have to be in this for weeks. Maybe I don't have the finances to do that, or, just I don't have the time in my schedule to be going on a regular basis. A lot of these things, especially if they're caught early on, can be quickly addressed within a very short amount of visits with the right information.
Yeah, and I think that's so helpful, because instead of, guessing and just trying a bunch of stuff you find on the internet, like if in 1 or 2 visits you can have exactly what's going on, and it's probably gonna, I'm almost definitely gonna save you money in the long run, and time and pain of this issue you have going on. So I think that's super important as well.
Pain of not being able to do the activities you want to do.
Yeah.
So nobody likes being sidelined. Let's be serious.
No.
So yeah, absolutely.
Yes. Thanks for joining, Amanda. Yes. I'm super excited to be to learning myself. So yes. And if anyone watching right now has any questions, please post them below while she's on here live. Anything else about leaking that we haven't covered, specifically with running and everything, that you can think of?
I know that my more recent kind of discussions and things have been really about urinary leakage, but I would also like to say that bowel leakage is a thing too.
Oh yeah.
It's less common, but it also is a possibility and can happen. So know that that is also a thing and is still in the category of a pelvic floor issue, because the pelvic floor is responsible for supporting the entire sling underneath the pelvis that helps to regulate bowel and bladder function as well as sexual functions. So if you're having issues too with maybe bowel control on your run, or having any pain in your pelvic area during your run or after, long-term tailbone pain, any burning sensations around that pelvic floor region, all of those are all symptoms of the body saying, hey, something's not quite right. And that you would definitely benefit from seeking out a pelvic floor PT to get some guidance around that.
Yeah, I think that's super helpful too, because as runners, I feel like there's been times where you're out on a run and you're like, I have to go to the bathroom. Maybe just once in a while it's fine, but if that's happening all the time, then you want to, probably more than, I think a lot of people are going to go right to their doctors too with either of these. But know that if they're just telling you I don't even know what the normal thing is, medication or more imaging, or I don't know, know that there are physical therapists that specialize in this, and it's going to be your best choice for actually fixing the issues. So
a good point that you bring up, because a lot of healthcare professionals still, unfortunately, do not know that pelvic floor physical therapy exists. And that's another challenge too, that usually, the primary person that people think to go to with these issues is your physician, which totally makes sense just with the way that our medical system is structured. A lot of physicians, though, don't know about really pelvic floor dysfunction in the overall context that someone like a pelvic floor physical therapist does. And so, they may order imaging or different things like that, but imaging is not going to show anything of help in this case because it's more of a muscular strength / coordination issue. So imaging, x-rays, MRIs, all these things, I've had patients that have gone through every single possibility and everything comes back clear. And then their doctor's like, well, I don't really know what to do now because everything looks fine. So know that you may have to advocate for yourself and say, hey, I'd like to really see a pelvic floor physical therapist. Can you write me a referral for that and things? And know that it may take you as an individual being an advocate for yourself to help ask for that because most of the time it doesn't go the other way.
No, that's super helpful. Awesome.
In mind too, it's speaking to other kind of leakage issues or symptoms. Something else too that I put in this category is that maybe you aren't directly having leakage, but you may be already doing some things that help prevent that from happening prematurely. So when I have runners that tell me like, oh, I always make sure to go to the bathroom before I go on my run, or I always make sure at my halfway turnaround point, there's, you know, the Starbucks there at the corner, and I always make sure to run in and go. You know, or I know that every single time I come back from my run, if I don't go to the bathroom right away, I feel like I'm going to totally just wet my pants. Those are also signs of pelvic floor issues. So urgency frequency issues are also another sign that the pelvic floor is being overly challenged and needs some support around being re-educated. And those are also symptoms that could, you know, be related to other pelvic floor challenges that include prolapse, if you guys are familiar with that. Prolapse is a whole nother diagnosis around either the bladder, the uterus, or the rectum that is actually kind of descending down through the pelvic floor and not staying suspended up in kind of that pelvic cavity where it's supposed to live. That's common usually through some challenges with pregnancy and delivery, but it can also happen regardless of those cases. Their podcast too.
Yeah.
So just know that that is something also to be aware of, that urgency frequency thing, and to seek out pelvic floor PT for help around that also.
Yeah, that's awesome. I'm glad you brought that up, because I was gonna ask you about that, because I have for anyone that knows me personally, you know, I always go to the bathroom. I personally go to the bathroom like probably once an hour, and I know from any women's health PT that I've talked to, like, and everyone has their own opinions. I do drink a lot of water, but they're like, maybe that's not normal. You should be waiting a little bit more. But I was going to talk about, or ask about urgency too. I am that person that before I run, before I do any, like, I want, like, I think it's more of a habit, but I want to go to the bathroom right beforehand. I don't want it to be half an hour beforehand. So I was going to ask on that too. So I'm glad you brought that up, that urgency is also another thing that women's health PTs can help with.
Another thing, and I mean, I'm not against the idea of like, yeah, if you're like, hey, I'm going out for my 10-mile run and I don't want to like lose my rhythm, you know, like in my couple of miles, and being like, oh shoot, I should have gone to the bathroom before I left. But more of the idea that like you almost become anxious thinking about the idea of like, oh my God, if I don't go before my run, I know that I'm going to have to go on my run and I'm not going to be able to hold it. Like that train of thought,
yeah,
versus just the like, oh, I should go because I know that I'm going to be out for a while and I may or may not have a bathroom that's easily accessible on my trail or my route or whatever.
Yep.
You know, and sometimes there's a gray area with that question still, but I think most people usually kind of know when I say that, like, oh yeah, no, I do it because I'm honestly like worried that I won't be able to hold it, or that kind of thing. Yeah. So more related to that, yeah, definitely it's important to consider, yeah, how much are you hydrating and things like that. The bladder has the capacity technically to hold for 3 to 4 hours, assuming that we're not having an excessive amount of intake of volume, right, beyond what's normal. And so a lot of times too, the bladder has a reflex that allows us to know when we need to go. And that bladder reflex can be trained. It can be upregulated to be too frequent. Mm-hmm. And then in some cases with excessive dehydration and things like that, it can be downregulated, okay? But usually the former is more of the apparent issue. So if you are feeling like you are getting this urgency sensation as if your bladder is so full it's going to burst and you have to go like every hour, that is a sign that something's going on with bladder things and that bladder reflex that is a pelvic floor issue that needs to be retrained.
That's helpful. That's
amount of voiding for urine output in a day for men and women is about 5 to 8 times, one of which is acceptable overnight. However, any more than that, there's an issue. Or we need to be considering how much are we hydrating. I'll do kind of bladder diaries with patients, different things like that to sort of see what's going on. Because sometimes people don't really realize like, oh man, I am like just taking in way too much volume, or they are consuming a lot of diuretics, different things like that that can be changing, you know, our bladder signaling and voiding kind of frequency.
Yeah.
So, yeah.
That's awesome. Super helpful, super helpful. Let's see. So we have anything before I look at this question, anything else more on that bladder and urgency, frequency, leaking? I'm trying to think.
Yeah. That I think we covered a good amount of stuff that I feel like is helpful in kind of a general sense.
I think it really helps people to know when to seek out for care from a women's health specialist.
that too, and I'll either like write this in the comments below or whatever afterwards. But there is an incredible pelvic floor and women's health PT named Tracy Scher, and she just released a huge asset to everyone in terms of pelvic health access, yes, and just developed this global health directory. And so there's a lot of us pelvic floor PTs and kind of pelvic health specialists, both anywhere from like a fitness professional that specializes in this area to physical therapists to OBGYNs to sexual sex therapists, all these kinds of things that span the scope of pelvic health. And that's a really great resource to be able to find a clinician near you. So I'll put that down in the notes at the end. It's pelvicguru.com.
Yes.
But that website is also a plethora of knowledge in terms of other points that I've brought up. She has tons of blog posts and guest blog posts. It's like one of my favorite things to recommend to people that want to learn anything about pelvic health related topics.
Yeah.
She's wonderful and has put together a really amazing directory, and it's continuing to be built. All of us are inputting all of our information, and it just recently was kind of released about maybe a week ago. But until then, it's been really difficult for people to find a pelvic floor physical therapist because we are a little bit more rare. And then in addition to that, sometimes it's just hard to know where we are.
Yeah.
Because there hasn't been like a centralized system to find us. So know that that's also available now to make it easier.
Yeah, that's so awesome. It's such a great resource. And I actually did see Tracy did hop on for a second. I don't know if she was listening or not. So Tracy, I don't know if you're still on, but she did hop on for a second. So.
If you're still on, Tracy, you're amazing.
Yes,
thank you.
You are.
And even if you're not on, you're still amazing. Just everybody go to pelvicguru.com because it's fantastic.
Awesome. Yes, that'll be super helpful to have that in the links too. So awesome.
Yeah.
You are, I will tell you, it's not affecting, I don't think, you are cutting out when you first start talking. It cuts off just for a second, but it's fine. So, but yeah.
Maybe re-angle. Sometimes they're a little sensitive.
Headphones can be on and off, but otherwise it's great. So awesome. So we'll go into the next kind of topic we wanted to talk about today, which was really exercise during and after pregnancy. I tend to get a ton of questions about that, also about diastasis recti, questions about what can I do, what can I do. So I just asked Kristen if she wouldn't mind touching a little bit on that. And I did see someone had asked that above, and I had one other person that asked in my stories earlier as well. Let me just read this question, make sure there wasn't anything difference that you can do on postpartum to strengthen going back to running. Would love to put yourself on the right track. Yep, so perfect. So same question. So we'll answer those questions first. So I guess if you want to start with, we'll just start with during, and then I think it's gonna be after the 10 more questions, but we'll start with during pregnancy. Any suggestions you'd like to give women?
Really important kind of topic and sort of a hot topic, I think, especially in any type of kind of physical fitness space. And there's a lot of conflicting information, which is also what makes it difficult. But I think that if I can share anything with this, it's that there is no one size fits all, and there is no exact cutoff in terms of at this date, I should or should not do X, because it really depends on each individual as a person. What is their, current level of fitness? What is their, body awareness level at? What is this their first pregnancy? Is this a multiple pregnancy? Is this their, meaning twins or triplets or whatever? Is this also like they've had multiple pregnancies and multiple kids? There's lots of different factors to consider in this case. So my suggestion for anybody is, again, definitely seek out a pelvic floor therapist to get some guidance. It's super helpful from a prophylactic standpoint while you're pregnant to go in and see one. We're super helpful and knowledgeable in a lot of different aspects, from, helping with strengthening things, helping with support and pain management around just body changes that are going to happen. Also around recommendations for maybe different, support slings or belts or different things that you can wear to, offload your pelvic floor and give some support to your abdominals and your low back while all of these changes are happening in the body. And so with that too, I usually recommend all of my moms, as long as their body is able to do this, is to say, hey, your first trimester, is you can still often kind of be doing activity level you were sort of doing before. And then once you start to enter into your second and third trimester, really honoring that it's a better idea to start to be softer to your body, still maintain strength and fitness levels, but to really start to scale back a bit in terms of your higher dynamic activities, because it does start to put a lot of extra stress on the pelvic floor that in the short term may not be noticeable, but on the long-term recovery aspect tends to sometimes be a little bit more stressful and challenging than people may realize in the present moment, or have gotten enough information about on the front end. And that also ties back into diastasis issues too, because I think unfortunately there's also mixed messaging around the like, well, if you've always done these activities before your pregnancy and you didn't have any issues, then you should just be able to do all of them anyway through your pregnancy and you'll be totally fine. That's also not fair. And that's also not appropriate in terms of recommendations. There are plenty of elite athletes and that have been told that and have operated in that way. And there's more of those women that are being brave to come out and go, actually, I pushed myself too much and I shouldn't have. And it felt fine in the moment, but sometimes just relying on what is my body telling me isn't enough in those situations. Everyone has a different level of body awareness.
Yeah.
And what's going on.
Okay.
So I always recommend, I want you moving at least 30 to 45 minutes a day. And that can include, kind of alternating certain days, whether it's walking or, kind of on the elliptical or something like lower impact cardio. Swimming is another great option. And then I want my moms doing, 3 to 4 times a week, some type of strength training. So, resistance bands, lighter weights, things like that, but maintaining good bone density, good muscle strength and things like that. Because once you have your little one, I feel like, you need your strength, especially in that. You're lifting a lot of things, you're carrying stuff, you're putting babies in and out of car seats and, strollers and cribs and all these kinds of things. And then you're carrying all these bags with all the supplies, like you have to be a freaking pack mule. So we need to be maintaining strength and not be telling women that they're so fragile that they shouldn't be doing things, but also understanding what some of these higher dynamic activities what they can be putting extra stress into a system that doesn't need that extra stress, and they can still get a great benefit from other forms of exercise. So I know that that's kind of a general statement,
yeah,
but I think that it's because I think that a lot of people are looking for this more cookie cutter recipe, which of course would be a lot easier and make my job a lot easier. But at the same time, it needs to be tailored to the individual.
That's what I was going to say. I was going to say, it sounds like it's really going to be each on an individual basis. Like even what you were saying, like different people even have different body awareness. Like, because, I would think it's like mainly, listen to your body, but that's a good point. Like some people they just don't have as much awareness. So where is too much, I'd be more interested on the end of like too much, especially with the running population. They tend to be go-getters, so that's helpful to hear, and just know that could be in your best interest really to see someone individually for what your exact needs are.
Too, by meeting with someone similar to my background, especially on the front end or during your pregnancy, you start to then be able to develop a relationship with that clinician that's going to help you throughout your pregnancy, and then also support you on the postpartum end and help you get back to whatever activities longer term that are important to you. So it starts to just build this whole helpful team for you, which makes it awesome. So I start, with some of my moms in that pregnancy phase, then we transition to their postpartum phase, and then it's getting them back to doing whatever it was that they weren't able to do due to pregnancy or whatever, or just reconnecting their body to be able to go back to those activities safely.
Yeah.
So it ends up being a really beautiful kind of continuum and relationship
right.
for that process. So, too, I think specifically with running, I think sometimes people don't realize when we're running, we're putting anywhere from 8 to 12 times our body weight through each leg as we run, okay? So then you compound that when we're pregnant with the relaxin hormone that's in our body that's making everything more hypermobile to accommodate for all the changes that are happening. And then you're also putting, 8 to 12 times more force down through your whole skeletal structure when we're running. And then also thinking of like, okay, that 8 to 12 times the body weight has to be absorbed somewhere. And often it will be through that pelvic floor system. And that's a lot. And two, the woman's body is gaining however much weight she needs to gain for that pregnancy. So that's also usually an unfamiliar place for the whole skeletal system and the muscles of that body, because they're used to you being, let's say, 10 to 20 to 30 pounds lighter. And now as we're getting later and later into our pregnancy, we're compounding extra weight with more hypermobility. It starts to create some really big challenges in the body that cost benefit analysis, in my opinion, doesn't start to become, you know, a good place to test things.
Yeah.
I think it's supportive to think about, how can I scale back a little bit in the short term for longer term gains later.
That makes sense. Yeah, you got to think about your body afterwards versus just here in the present moment too. So so with before or during pregnancy, there's not necessarily any, you know, hard cut, you know, guidelines you would give, right? No absolute, don't do this. Right?
I personally, like I said, tend to recommend to my moms in general, feel that first trimester, and, you know, unless we are getting symptoms or we have anything that's really like jumping out at us, like if you still want to do some of those higher dynamic whatever things, know that you have this little window right now that you can kind of get it out of your system, knowing that we're going to be temporarily benching this in a little bit. And then knowing that that doesn't mean you don't move, that just means we incorporate other movement for your body. And in doing that, you know, giving education around that. I will never tell a mom, you absolutely cannot do this. I recommend, hey, here's kind of the cost benefit analysis of this activity. I think it's important to educate people, but I also don't think that it's fair to shame people and say, hey, you're at whatever week, you should or should not be doing X.
Yeah.
Each person's body, it is your choice. You know, I think that that's also important to say. But from as a PT with my patients, as well as I think all of us PTs, we're looking at the short term, but we're also making analysis for the long term.
Right.
And, you know, short term, long term gains need to be considered in the equation. So if we're talking about an overall blanket statement that I kind of recommend for my moms, yeah, by the time you start your second trimester, we need to start adjusting your program to accommodate the changes in your body so that we have, you know, the best outcome possible.
Yeah, no, that's awesome. And because you just hear so much out there like, oh, you can't do this, you shouldn't do that. And even as a PT, sometimes you're like, it's overwhelming to, you know, things that patients will to say to you. So it's helpful to hear. So awesome.
No hard and fast date. There's no hard and fast exercise list of do's and don'ts. And that's kind of the beauty and the challenge in this situation. There is, I think, so much conflicting information, and why it is so hard to know, okay, well, what am I supposed to do?
Right.
So again, come and see a pelvic floor PT to help answer those questions for you and figure out what makes the most sense for your particular case individually.
Yeah, awesome. Thank you. So I'm going to guess it's going to be kind of similar, but let's move into after pregnancy, kind of the suggestions you like to give to your patients.
Statements of it needs to be tailored to you are still consistent in this case.
Right.
And I think too, in this phase, especially postpartum, again, it really is variable depending on the individual. If this is the first pregnancy or if this is a multiple type pregnancy situation, you know, what was the strength situation of that mom in between multiple pregnancies? That all needs to be considered and factored in when we're recommending postpartum care. I think too, there's a lot that needs to be supported around this time frame, because often moms are sort of, you have the delivery and then about 6 weeks-ish after, our medical system has that postpartum follow-up visit that, in my opinion, doesn't give a lot of helpful information to moms. Most of the time, they're quick screened, making sure that there aren't any infections or anything that seem to be kind of going on, any big glaring issues. And then women are told, oh, everything looks good, just ease back into things. That's not helpful. Okay. And really challenging, because women then interpret that as like, oh, well, I can just kind of go back and do whatever. And that's really where they need direction. They need support. They need more of a specific guideline of how they need to ease back into things.
Mm-hmm.
Okay. So in a perfect system, I would say at that 6-week mark, the postpartum visit should be with a pelvic floor PT.
Yeah.
So that we can evaluate and go, hey, what's going on, and give some guidance and start to re-educate this body that just did this monumental thing of growing a human and birthing a human for 9 months, and all of the physiological changes that had to happen in that body. And that body doesn't all of a sudden immediately just revert back, right? That body needs to be re-educated, both in terms of alignment as well as strength and also coordination, because all of those systems had to adapt for the baby, and the body's smart and adjusts, but it doesn't just revert back to the old plan, okay? It maintains whatever alignment, posture, strength things, unless we're giving it new information back into the system. So on, you know, deep core, working on does the pelvic floor need to be taught how to contract and regulate, or is it in a heightened state where it's overly contracted and needs to be taught to relax? Reintegrating breathing, because our breathing is a critical component of our ability to regulate our pelvic floor. So that diaphragm, back to the very beginning of our conversation of that being part of that deep core system, if our diaphragm isn't working properly and we're not breathing well from our diaphragm and breathing more up here at our neck and our shoulders, then we aren't allowing for that good system of that intra-abdominal pressure to stay within a healthy system, okay? So it is critical for that pelvic floor to know when to contract optimally and when to relax optimally. So some of the first things I'm teaching my moms is how to breathe, and then also how to breathe with your pelvic floor. So as we exhale, that diaphragm lifts, and that pelvic floor also has a better opportunity to contract and lift. And then reflexively, as the diaphragm lowers to allow air in when we breathe, that pelvic floor, that's the ideal relaxation phase for that pelvic floor. So we have to breath with that. And if we're holding our breath or we're not allowing for proper breath, then that changes how much pressure is being put down on the pelvic floor, and often adding stress to the pelvic floor, which then doesn't allow for a good retraining of that deep core system to then translate back into regular life. So you can do all of the abdominal exercises you want and all those kinds of things, but if it's not being reintegrated, then we still have challenges in terms of movement related to something.
Yeah, well, that's great. I think, breathing is just such a simple thing that we don't integrate into, our health practices in general. And there's many things outside of even women's health that it helps with. And I know I've heard that from other women's health specialists, that breathing is a big part of it. So that's helpful to hear.
Other piece is also retraining women how to understand where their rib cage is with respect to their pelvis. So if we think about throughout the entire phase of pregnancy, as that baby is growing and our center of mass is moving forward, we tend to start to lean back, right, to accommodate for that change in our center of mass. We start to get an increased curve in our low back, that increased what we call lordosis. That pelvis is also rotating forward, so we're getting what we call an anterior pelvic tilt in that case, okay? This is all necessary for during pregnancy and to accommodate all the changes that are happening. When the baby comes into the world, that alignment and pattern doesn't automatically go back. It needs to be re-educated, and a lot of times my moms, if they don't get that education, or they see me much, much later after they've had their kiddos, we're talking, maybe their kiddos now are a couple years old, right? They've maintained this excessive curve of their low spine, their rib cage is kind of flared back, their pelvis is still anteriorly rotated, all those things, which is now the stability system is now your back versus being a working system of your front and your back line. So we need to be regulating too, how can we support alignment too, to allow for the muscles of that deep core system to be in a position to be more successful with our movements. So that's spending a lot of time teaching my moms, how do you figure out where your rib cage is with respect to your pelvis?
Yeah.
And then a lot of glute strength. So our glutes are really important for stability. They also, like I said, feed into the fascial structures of our pelvis and support that pelvic floor. So if you have a pelvic floor issue, you need some more support and coordination of your glutes. I have yet to find one of my pelvic floor patients that had an issue with pelvic floor coordinating that also didn't benefit from glute work. Okay. us runners,
Yeah.
we need our glutes.
Right, we need that anyways,
they are
right?
vital. Yeah. So fortunately, they're functional, but they're also, you know, really helpful for supporting these structures. So these are a lot of the kind of categories that I'm working within to kind of help my mom. So, you know, yeah, pelvic floor regulating, making sure that that, you know, system is being reintegrated with our breath, making sure that we're understanding what is our alignment of our rib cage and our pelvis, and then working on core glute strength to help with that deep core system. Okay. And too, back to that rib cage, we're also needing to think about my lats and my upper back and how does that tie in with my stability? Because if we're thinking too about all of the changes that are happening with a mom, they have their baby and then immediately we're all rounded forward with all the breastfeeding, carrying, all of those needs for this new baby. And so that's also causing this kind of collapse of our body over our core, creating more pressure down on the pelvic floor and not allowing our abdominals to really be supporting us. So it also creates this other challenge of, you know, efficiency for the and loading.
Okay.
So I'm spending a lot of time re-educating around that and getting that foundation solid.
Yeah.
Because once that foundation is solid, then the rest of the stuff goes really easy and quick. But it's when we try to jump over that less sexy phase and just start to jump back into, I just want to go running, or I just want to get back to my HIIT workout, or I just want to, you know, fill in the blank activity. I totally understand that people want to get back to their stuff and they've not been able to participate maybe in it for months. However, we have to have a certain foundation that's built in order for that progress to be safe and for it to not be the cyclical pattern of I ramp up and then I get hurt and I crash, and I ramp back up and I get hurt and I crash. So we have to give ourselves some space and support around that postpartum recovery phase and know that the 6-week mark is nowhere near where that's supposed to be done. That's where it starts.
Yeah.
Okay. And that you really need to give the body about a year from when the baby's delivered to be feeling like the body has reintegrated and is back to a more familiar version of yourself. Okay. And that's not to say that you can't get back to running or other higher dynamic activities before that. That's not what I'm saying at all. But in terms of the changes that are physiologically still happening in the body, it takes about a year. And if we're breastfeeding, that could be longer. Because if we're still breastfeeding, we also still have a lot of relaxin hormone that's still in our system that's making us hypermobile. So that also needs to be taken into consideration with our postpartum exercise strengthening programs. And I don't feel like that's often being talked about either.
Yeah.
Okay.
But
wish again that I had a list that I could just be like, this is what you do. But it's not that simple. Yeah.
So
exactly.
The first like 6 weeks, so like that tends to be the pretty typical follow-up range, right? Like I've never had a kid yet, but I've just, you know, hear my friends and saying that and everything. Would you recommend them seeing a pelvic health specialist during that time too? Or, you know, during that time, I mean, I would think that, you know, they wouldn't just want to be on their own for that too, ideally.
We're super helpful in a lot of ways. But yeah, I'd say if, you know, at least like, you know, at the soonest, probably about that 6-week mark, or even that 8-week mark, just to check in with a pelvic floor PT and get some information and some guidance is super helpful.
Okay.
Yeah.
But during the first...
you know, I would say in an ideal situation, I recommend my moms come in a little bit before they deliver so that I can give them information to be doing kind of on the front end, as well as to know what things they should already be doing at home for those first 6 weeks. Because I find a lot of my moms, those first 6 weeks are so overwhelming just with all of the changes that if they have to squeeze in another appointment to see somebody like me to learn it then, it's not a good time to be absorbing information. They're already at max capacity.
Yeah,
okay?
Right.
But if they can get some of that support on the front end and already know how to be practicing their breath, knowing how to integrate some of those things, knowing some gentle exercises that they can start to be incorporating, then they can already be doing that in those 6 weeks at home.
Yeah.
And then I check back in with them and start to see them sometimes as early as that 6 week, you know, to 8 week, depending on their schedule and sort of what's going on.
Yeah. Do you know, like, will you ever see anyone start running before that 6 week mark? You know, especially like, let's say I'm just thinking like even like an elite runner or whatnot, will they try to start running with it before that time frame? And is that a smart idea and just all individualized?
It happens. I'm not going to say that it's can't happen. But from the vast majority of what I see, and the vast majority of even some elite athletes coming out and sharing their stories that have started that soon, they recommend having waited longer. Yeah, again, back to that cost benefit analysis, I do not recommend it. I think it's really it's putting a lot more stress than is worth it on the system.
And it's not always just listening to your body necessarily, that you don't know what's going on down there necessarily. That's helpful.
To consider that I don't think a lot of people think about is the idea that when we have a baby that's growing inside, it's creating, contributing to that intra-abdominal pressure system that I was talking about, right? So it's creating that feeling of somewhat of stability within our system, because it's just taking up all that room and kind of filling in all the real estate there in our abdominal cavity. When that baby is delivered, all of a sudden we lose this huge pressure system, and the body kind of is a little bit more hypermobile. It's more difficult to align the body properly and all those kinds of things. So if you then think about that and then send a body like that out to run, that's challenges for the body to create a healthy base of stability through the pelvis and the trunk, to then be allowing for that 8 to 12 times of force coming up the leg into the body.
Yeah, that makes sense. I'll probably definitely have to call on you when I decide to have a kid. You'll have to hold me back. I'll be like, I'm fine. I'm listening to my body. 2 weeks. Let's go. Okay, maybe not that soon.
I got you covered. I got you covered. It'll be fine.
I'm like, I listen to my body. I'll be fine.
Yeah. And I'm never the type of PT that wants to say no. Yeah. I'm always like, how can we wiggle around this? Or how can we just decrease the amount of time that you're doing it for and work up, or, all those kinds of things. And as a runner myself, I know we are terrible at being told not to run. We will run through everything, myself included. I've done it. Okay. Yeah. But it, at what cost? And with some of this stuff, it ends up being a bigger cost, I think, than people realize, and contributing to increased, challenges that may lead to a development of more longer term chronic issues. That if we have the and we allow the body to have some time to become strong, that we then don't, long-term benefit is so much more worth it. And I don't think any of us would ever, say that it wasn't beneficial to wait and know that I now have a running career, that I can continue to participate in, versus saying, oh, well, I got that 1 or 2 runs in at that 6 and 8 week postpartum mark, but now I can't run. Because I have all these other challenges that my body can't handle.
Right. And I think that's just like any injury, really, right? Like the long-term benefits versus the short-term benefits. So,
while, pregnancy isn't necessarily categorized as like, a particular injury, and I don't want to make anybody feel bad by saying pregnancy is an injury. That's not what I'm trying to say, but it's more in the sense of like, if we took any other condition and you had to have a surgery, or you had this huge life-changing event like pregnancy, okay, would we ever say, oh, like 6 weeks after that, like, yeah, you should be back doing box jumps, and you should be back running, 10 miles, and you should be doing, it's like, probably not. Right. Or if we think of any post-surgical rehab program as PTs, like usually there's, okay, for the first 4 weeks, like you're pretty much not allowed to really do anything. And then maybe at the 6-week mark, we start to maybe let you do some gentle range of motion. And then maybe at the 2-month mark, you're lucky if we're allowed to maybe start doing some strengthening. Same to the pregnancy situation. But for some reason, our healthcare system doesn't think of it like that. Right. Just like C-section is technically a surgery, okay? It is billed as a surgical code, okay? But that is the only surgery that we have in our healthcare system that does not have a protocol to release you back to
that's crazy.
Your activities, okay? So that's a whole nother soapbox that you don't want to open up with me right now. But that's where I'm coming from.
Yeah, no, that's super helpful. And I know we'll wrap this up, and I know you gotta go pretty soon, but this has all been super helpful, and maybe we'll bring you back on if anyone that's watching this later too has questions. I mean, I think there's a lot of topics where we're like, we could have a whole nother episode on that. So we can definitely
love to
bring you back on and talk more about this stuff. And
sure.
Definitely has me more interested, and I think eventually it's something I'm gonna need to get specialized in too myself. So I'm super excited. But with that,
I just feel honored to have been able to have the conversation, and happy to help share whatever information I have, either with you or any of, the listeners here and stuff like that, so that we can all help support each other regardless of what avenue we're in as a clinician or just as general public, and spreading knowledge and information to friends and whatnot, because I think that's the other big piece that I think is important. Like, us ladies sharing this information with our other girlfriends, and whatnot, because the more knowledge is power in this situation.
So if anyone's watching this, you want to share it out, like, please do. Like, that would be awesome. I just think it's something that's just not addressed in general very much at all. Like, and people, it can be private about it too. And so feel free, please, to share this out with any of your friends, anyone you think might need to hear this. At all. And you are a wealth of knowledge, Christine. Thank you so much. We had a lot of comments I saw going through. That's great teaching. But where can my listeners find you at if they want to get into contact with you?
I am on Instagram, Pieton, PT, Pieton, PT, and I'll put this in a comment too below with the global directory I was talking about. I'm also here on Facebook too, same thing, Pieton, PT. And I'm probably more active on Instagram, to be totally honest, but I need to up my Facebook game, so I'm working on it. And then my website too, I'll list that as well. I have my blog on there, and I recently, within probably the last 2 weeks, have personally decided to make more of a shift to my practice being women's health focused. So all of my social media stuff is going to be pushed in this direction in terms of these types of topics and content, blending pelvic health with the orthopedic and sport and all that kind of stuff. So feel free to follow along there. And that way we can continue our conversation together. And that way too, if you guys have any questions, comments, anything, if you want to reach out privately, by all means, my email and everything will be there too, or you can private message me through Facebook or Instagram, whatever method you prefer is totally cool.
Yeah, awesome. And I know we're going to list, stuff for everyone to access if they can find someone in their area. Do you do anything online? Like, say someone's listening and they're over here in North Dakota. Do you, is there anything that you do offer that is, that you can just offer online?
Wellness kind of consults and things like that. If they're trying to go through insurance or formal telehealth, I can't do that just yet because I just haven't set it up. And to be honest, I need to look into what the California Practice Act is around that, and that's on my to-do list, but I haven't gotten there. But that is my next kind of chapter 2 of wanting to be accessible virtually, because I think there still can be a lot done in terms of the education, even just verbally and talking about things. My preferred is obviously to be there in person and be able to, be all hands on deck, but I'd still much rather be able to help support and provide knowledge and, accessibility to someone, and have that be virtually versus none at all.
Right.
So so I'm in progress.
Yes, we all are.
Around that, but
there's things I do too. So
totally.
So, awesome.
But yes, but happy to serve as any type of resource. And like I said, I can do wellness things, via Skype or whatever to kind of help with stuff.
Yeah.
And I'm happy to do that as well. So, yep.
Great. Well, thank you for that. Well, any last words? Otherwise, we'll wrap this up. And thank you so much again.
Much again for having me. This was super fun.
Yes.
And I'm glad that you guys all found it helpful. And like I said, this is an open conversation, but this is by no means closed. So feel free, if there were any things that came up or that you remembered or whatever, throw them in the comments below. And I have a patient that I'm moving on to soon, but I will look back through these comments later on this evening when I have a moment, and I can respond and comment a little bit more thoroughly.
Yeah.
And then, like I said, feel free to reach out. I love to talk about this stuff, as you can tell. Yes. So please don't hesitate to reach out and connect and keep the conversation going. So thanks so much for having me, and I would be happy to come back and talk about any of this stuff or any of the side comments that got thrown out that we can circle back to.
Awesome. Well, thank you so much. I'll let you get to your patient, but so happy having you on, and I'm sure we'll bring you back on. So I'll talk with you soon. Have fun.
Kristen, thank you all.
Have fun in sunny California.
Bye.
Bye.
Thank you. Bye.